Hello guys, my name is Vishnu. So today I am going to talk to you about white blood cell count. So actually this is actually for PharmD students and anyone who is from a medical background. You actually have this topic, like you may have to learn the laboratory parameters. There are normal values, in which condition it increases, in which condition it decreases. So what happens is that in most of the books it is explained in detail. But when it comes to the syllabus that we learn, it becomes very rudimentary, means it reduces a lot. We don't learn in this much of detail. And I'm not saying that this is syllabus oriented, because obviously this presentation is 12 slides long. So obviously for a single parameter, you're not going to study in detail. But as the title of the PowerPoint suggests you, or the title of the video suggests, this is truly related to practical knowledge perspective. So people from any medical profession can refer this. And definitely there are a lot of things in this slide which may help you in your profession, which may suffice or satisfy your theoretical and as well as practical knowledge sphere. So today I'm going to talk about white blood cell count. So we will just have a general introduction into white blood cell. What are the normal values? What are the critical values? Means critical value means critically low and critically high. In which condition WBC increases, in which condition WBC reduces, and some interesting practical points. So this is something that everybody knows. Usually white blood cells are also known as leukocytes. And leukocytes are classified as granulocytes and agranulocytes. So that is on the basis of the presence of granules in the cytoplasm. So granulocytes usually contain a distinctive granule. A granule is present, so which is visible under specific staining techniques. So for examples of those are neutrophils, basophils, and eosinophils. Agranulocytes are exactly the opposite. There is no distinctive granule present. So in that comes monocytes and lymphocytes. Actually, the endocrine system is very important in this regard, because the endocrine system produces hormones, as you know, and these hormones control the activities of WBC. So it is with regards to the production of WBC, the storage of WBC, the release of WBC from tissue when there is an antigen or any kind of inflammatory condition, and also the destruction of WBC. So if you are having any kind of problem in your endocrine system, then WBC count may vary. So that depends on which kind of endocrine problem you are suffering from. So this is what I'm trying to tell you. These are the practical aspects that you can know. The lifespan of WBCs is 13 to 20 days. As you know, for RBCs, it is 120 days. For WBCs, it is 13 to 20 days. And after 13 to 20 days of lifespan, they are destroyed in the lymphatic system, and they are excreted through fecus. So this is how the WBC regulation occurs. WBCs also have the following functions. They fight infections, as you know very well. WBCs are important in that. So in WBCs, we have something called macrophages. So macrophage have a process which is known as phagocytosis. So when a foreign organism or antigen comes into our body, they cover or they encapsulate the foreign organism and they digest it. So phagocytosis is also known as cell eating. WBCs also produce, transport, and distribute antibodies against antigens. So whenever an antigen enters into our body, our immune system gets activated. And in according to the activation of the immune system, WBCs are produced and distributed. And obviously, WBC is a very important marker to understand the severity of different kinds of diseases. Like if you are having inflammatory conditions, in that also we can understand how the severity of the condition we can understand through WBC count. If you are having some cancers, we'll talk about that later. In that also WBC count is important. If you are having any kind of infections, or if you are very severely immunosuppressed. In that condition also, WBC count plays a major role. Now let's talk about what are the symptoms of increased WBC. So these are some of the signs and symptoms that may be seen if WBC count increases. You can have fever because whenever an antigen enters into the body has a tendency to fight the infection, and that compensatory mechanism is called fever because it raises the temperature so that the organism is killed. Bruising may also happen, especially in conditions like leukemia. In leukemia, there is increased WBCs. So what happens is that the body is not able to produce enough platelets to plug the bleeding blood vessels. So in that conditions, these people can suffer from easy bruising. Like for example, a patient with leukemia, if their platelet count is very low and they are having a cut on their finger or any part of the body, it will take a long time to heal. And there is something called petechiae. These are tiny purple or red colored spots on the skin that may appear on your arms, legs, stomach, or buttocks. This may occur in leukemia or immune thrombocytopenia. As I said before, in leukemia also it happens. And in immune thrombocytopenia also it has been observed that WBC increases, and as mentioned, platelet will reduce. And fatigue is also observed. And this is something interesting. If your WBC count increases, also you will have fatigue. And if your WBC count reduces, then also you will have fatigue. So this fatigue is usually associated with leukemia in majority of conditions because that disease itself is a very dangerous condition. So fatigue is observed. Anemia is also seen. So this is usually related to an autoimmune condition. Autoimmune means your body's immune system considers your own body as enemy and starts sending antibodies towards it. So I hope you know of many autoimmune disorders. For example, rheumatoid arthritis. We have systemic lupus erythematosus. We have psoriasis. Like that, we have many autoimmune disorders in which our own immune system is responsible for the damage that is happening in our body. So if you are having any kind of autoimmune condition, for example, autoimmune hemolytic anemia or anything like that, in that condition, you may have damage to the bone marrow as well. So that can also lead to anemia. But then you should also remember that if the bone marrow is very severely damaged, then your WBC actually reduces also. It is a condition known as aplastic anemia, about which we'll discuss later. You can have bleeding of mucous membranes also, which is known as epistaxis, because as I said, the platelet count tends to reduce in some conditions. Weight loss is also seen, but actually always remember that obesity is a chronic inflammatory condition. But weight loss has also been associated with WBC, elevated WBCs. So that has been seen in some conditions. It is not necessary that it will happen in everyone. And definitely infection is a very important marker or sign of increased WBCs because the immune system is trying to fight the antigen or the organism that has entered into our body. If we look at the reference value, see, this is something a bit very controversial because when you are if you are a healthcare practitioner or if you are a student and you are posted in a hospital or something like that, you may find in different hospitals or different healthcare scenarios, the normal value of individual laboratory parameter keeps on varying. So we exactly cannot say the correct reference value. We have American and Canadian standard guidelines, but in different hospitals, they have their own. So this I just referred from a standard textbook. So on the basis of that, I have made, it may vary, but I don't think it should drastically vary. If it is a black adult, then especially the Negro population or black adults, in that condition, 3,200 to 10,000 cells per cubic millimeter, or we can say it as millimeter cube also. And if you are converting this into, in some hospitals, the value will be measured in 10 raised to 9 per liter also. In that condition, we can say 3.2 to 10 cells or 3.2 to 10 into 10 raised to 9 per liter. So the unit usually changes, but cells per cubic millimeter is the standard value. When it comes to adults, we have 4,500 to 10,500 cells per cubic millimeter. And in children, you can just refer this. It depends on age. And if you closely look at the normal values of children, depending on the age, you can see that in the initial stage of life, like 0 to 2 weeks and 2 to 8 weeks, the WBC count is very high. So if in children we are observing like that, we cannot completely say that it is abnormal because the body is developing. And as the child, whether it's a boy or a girl, reaches a particular age like 15 to 21, it tends to get normalized. If we look at the critical values, critical value is any kind of value. If any value goes above that, or if any value goes below that, it can indicate life-threatening consequences. So if your WBC count is less than 500 cells per cubic millimeter, it is life-threatening, and in majority of cases, it is fatal. It has been seen in cancer patients, especially in the last stages. Or if they have a septic shock also, in those conditions, it has been seen. If your WBC count is less than 2000 cells per cubic millimeter, then it is said as critically low. And if your WBC count is greater than 30,000 cells per cubic millimeter, it is considered to be critically high. But again, as I said, till 30,000 in pediatrics also, it is quite normal. As I said, the age group in the previous slide, you can refer that. Now we are looking at the clinical significance of leukocytosis. In which conditions WBC count increases. So we have lot of reasons to explain for increased WBC. We usually say that WBC increases in infections, but it is always not necessary that it increases in infections. We have lot of other reasons also for the same. As we know that WBCs are classified in granulocytes and agranulocytes. So if any one type of WBC increases also, we can term it as leukocytosis. So if your neutrophils are increased, it's called neutrophilia. If your lymphocytes are increased, it's called lymphocytosis. If your monocytes are increased, it's called monocytosis. If your eosinophils are increased, it's called eosinophilia, which is usually seen in asthmatic conditions also. And if your basophils are increased, it's called basophilia. But there are some conditions in which all the 5 types of WBCs increase together. So those are some interesting conditions. For example, if you are very severely dehydrated, or if you are having loss of plasma volume, that means if you are very severely dehydrated, there is a condition in which your blood becomes very viscous. So that condition is known as hemoconcentration. So this may be seen in patients who are suffering from venous thromboembolism also, because there also sluggishness of blood, or the blood becomes very slow. So if you are having very chronic dehydration, and as a result of which hemoconcentration may occur, so the WBCs may rise. So if it is a condition due to hemoconcentration, then this patient should be advised to maintain their fluid intake. So a lot of things, a lot of practical stuff is there, which we can derive from this. If you are having mumps, pertussis, I hope you know it's whooping cough, and sepsis, suddenly there will be a rise in WBC count, and the WBC level rises so much that some healthcare practitioners or healthcare professionals may confuse it with leukemia also. They may think that the person is having blood cancer. So to understand the difference between mumps, pertussis, and sepsis and leukemia is that if there is a sudden temporary rise in WBC, it means that the patient is having infection. So it can be mumps, it can be pertussis, especially sepsis. But if there is progressive, means step by step, and a permanent rise in WBC, so that suggests leukemia, because leukemia, as you know, it is a cancer, and cancer is not something that comes today and goes tomorrow. So if there is a progressive increment in WBC count, that suggests leukemia. So this is a kind of differential diagnosis that you can make out. And obviously, leukocytosis happens in acute infections also. So it depends on the severity of infections, like what is the quantity of organism in your body and how much it is resistant to antibiotics or antivirals or antifungal, whatever it is. The resistance pattern, as I said before, which kind of organism is there in your body and what is its resistance pattern. The patient's age is also important because if the patient is very young or if the patient is very old, then definitely there is a risk of low immunity. And bone marrow status is very, very important, especially in patients who undergo cancer chemotherapy, because most of the chemotherapeutic agents have a side effect. They cause bone marrow issues. There are other drugs also. So bone marrow status is very important. And if we go to the other causes of leukocytosis, that can be leukemia, myelodysplastic syndrome. Myelodysplastic syndrome is actually a combination of lymphoproliferative disorders. It's actually a kind of cancer. If you are having trauma or tissue injury or surgery, in that condition also leukocytosis may be observed. If you are having malignant cancers, for example, bronchogenic carcinoma. So if you are having any cancers related to the lung, especially bronchogenic carcinoma, in that condition also increased WBCs have been observed. In uremia, this is very interesting. In uremia also increased WBCs have been seen. So if a patient with CKD is coming in front of you, in most of the patients, you may see increased WBC. It does not necessarily suggest that the patient is having infection. It may be attributed to uremia. So it depends on whether the patient is having acute renal failure or what is the blood urea nitrogen count. So all these things depend. If the patient is comatose, so that can be due to various reasons. In that condition also, it's been found that the WBCs may increase. Eclampsia, so that is actually usually happens because it is a kind of hypertension in pregnancy. So that usually happens because when the fetus is developing inside, the mother's body's immune system has a tendency to fight infections more. So in eclampsia kind of condition also, WBCs have been found to be elevated. There are various drugs and toxins or chemicals which can also increase your WBC. For example, ether, chloroform, quinine. Quinine is an anti-malarial. Adrenaline. This is very important. That is why when you are having stress or if you are in a very prolonged stressful condition, your WBCs tend to increase. And colony stimulating factors, these also increase the WBCs because the reason is that colony stimulating factors are those kind of medicines which help in improving your neutrophil level, especially if you are having very severe neutropenia. In that condition, we give these medicines. For example, filgrastim, sargramostim. Acute hemolysis also, hemolysis is a condition in which the RBC is breaking down much faster than its normal lifespan. So in that condition also, this may happen. Polycythemia vera. So this is a condition in which the hemoglobin concentration is very high. So what happens when the hemoglobin is very high, the blood tends to be very viscous. So that is a very important risk factor for venous thromboembolism also. And it's also a very important risk factor for, or it actually indicates increased WBCs also. And in seizures, hemorrhage and splenectomy. Splenectomy is removal of the spleen. So this is a bit important because always remember, if your spleen is dysfunctional or if it is removed, then your WBCs will increase. And if your spleen is working more than normal, then you will have reduced WBCs. So this is actually an inverse proportion. There are some conditions in which you have elevated WBC, but there may not be a clinical disease. So which are those conditions? If you are having prolonged sunlight or UV light exposure, your WBCs may increase. Or any kind of physiological factors. For example, I said excitement. If you are very excited about something, that is also indicating increased adrenaline. If you are having stress or panic or something like that, there also adrenaline is involved. If you are doing too much of exercise, there also it is a kind of physiological stress. So that can also increase WBC. In pain and also anesthesia, cold or heat sensations also WBCs may compensatorily increase. Nausea and vomiting have also been found to increase WBC. Impact of steroids is very important because steroids are used in many patients nowadays for various conditions, and steroids have a very notorious problem. Actually, it has its mechanism itself is its problem in some populations because steroids are usually anti-inflammatory in nature. So anti-inflammatory means they are suppressing the hyperimmune status. So as a result of which it can cause immunosuppression. So if steroid is given to healthy patient doesn't mean that they are not having any disease at all. They may have some other disease, but they are being given steroids for some reason. In that condition, leukocytosis may happen. But if steroids are given to patients with severe infection, documented infection, then it may cause rapid spread of infection. Now we come to leukopenia. In which conditions leukopenia happens? So in viral infections, leukopenia is observed. Severe bacterial infection, septic shock, in all those conditions also, to some extent, leukopenia may happen. Hypersplenism, as I said sometime before, if your spleen is removed, WBC will increase. And if your spleen is working more than normal, then WBCs will decrease. So it is an inverse proportion. Immune-associated neutropenia. So neutrophil is a part of WBC itself. So if that reduces, that can also indicate leukopenia. And in fungal infections also, leukopenia has been observed. In bone marrow toxicity, that's quite understood because bone marrow toxicity means WBC. The function of bone marrow is to produce RBC, WBC, and platelets. So bone marrow toxicity means WBCs will be reduced. So these are some of the conditions in which bone marrow toxicity can happen. And because of all of these conditions that you are seeing in this slide, WBCs may reduce. Now, for example, you are seeing a patient's details, clinical data, and suddenly you saw that our WBC has risen or WBC has reduced. So we don't directly come into conclusion that it may be because of this or something. There are some situations in which false WBC values can also be seen. For example, whenever the blood pressure of a patient is evaluated, a common mistake that we usually see is that if the patient had a smoking session before, like for example, the patient actually had smoked before coming to the clinic, or if the patient had drunk any kind of beverages, it can be water also, or it can be a soda beverage or alcoholic, whatever it is. In that condition, false elevation in blood pressure may be observed. So that is why whenever we evaluate a patient's BP, especially in the OPD, it is always advisable to abstain from drinking any kind of beverages at least 1 to 1.5 hours before you take the BP. Because when you are drinking any beverage, there is something called process of urine formation. So the urine will get stored in the urinary bladder. So in that condition, because of the pressure, obviously you will try to hold it or whatever it is. So in that condition also, false elevations may be seen. So like that also, there are some conditions in which false WBC decrement or elevations may be seen. So these are some of the interfering factors and some important catch points. So in early morning, there is a reduction in WBC, and in the late afternoon, there is an increment in WBC. So this is actually not something that everybody follow. All these things we cannot apply in real life all the time, but these are some interesting things that may be good for your knowledge perspective. And when it comes to the age, as I said before, in newborns and infants, the WBC count increases. In stressful situation, for example, if the person is in too much of stress or the person had a panic attack, or something like that. And we saw that the person's WBC is elevated and we immediately started the patient on antibiotics. So that does not make much of a sense because stressful situation increases adrenaline, which usually has a tendency to increase WBC. And there are some other miscellaneous factors also which increase WBC. For example, it depends on the gender to some extent. Exercise, as I said before, some medications are there, temperature variations, pregnancy and anesthesia. All this are also deviators or negative or positive influences of WBC count. Now we come to the practical knowledge perspective. What are the things that we can know? So before testing a patient, what are the things that we should know before testing a patient for WBC count? Overhydration or dehydration should be avoided. As I said in the risk factors, if you are dehydrated, there is a condition called hemoconcentration. In that condition, the blood tends to be very viscous, as a result of which the WBC count will increase. And if the patient is overhydrated, fluid overloaded, in that condition, the blood tends to be very dilute, which can give false negative WBC values, or it can show false reduction in WBC. So over or dehydration should be avoided. And in some areas, I have read that if a patient has been given a diet which is too much rich in fat, so that can cause lipidemia. So that may alter test results. But normally, food does not have a very big impact on WBC analysis. Now, the next part is very important. For example, we have tested a patient and it has been found that the WBCs are too low. So it can be either granulocytopenia, maybe the monocytes and lymphocytes are low, or maybe it can be it can be neutrophils, basophils, or eosinophils are low, or it can be agranulocytopenia, in which monocytes and lymphocytes are low. So in any condition, if the WBCs are too low, what can be done? This is also applicable to those patients who are severely immunocompromised or who are undergoing cancer chemotherapy with extremely low WBC count. So if the patient is admitted in the hospital or in the ward, ICU, whatever it is, fresh fruits and vegetables should be avoided as much as possible, because when it is coming from the mess or the kitchen, it may be a source of contamination. So in normal conditions, we do not get affected if we eat a fresh fruit after washing or something, because even if there is bacteria or anything like that, if our immunity is very good, we will fight it off. But a patient who is very severely immunocompromised will not be able to fight it off. So that can lead to further complications. So that is why fresh fruits and vegetables should not be given. Instead, if you are giving a diet to a patient which is having vegetables, then it should be sterile. That means you should only give cooked food to the patient. So this is something that needs to be kept in mind. Intramuscular injections should be avoided as much as possible. Do not take rectal temperature or give suppositories or enemas or perform rectal examinations, because that can either cause bleeding or it can increase the risk of infections also because of the reduced immune status of the patient. Avoid teeth flossing. So flossing, or if you are using any kind of brush which is having a hard bristle, so those things should be completely avoided. Actually, this teeth flossing, with this I remember a very interesting fact. You may know that phenytoin causes a side effect known as gingival hyperplasia, in which there is swelling of the gums, and then it can lead to gum bleeding. So in that condition also, patients should be advised to not brush their teeth very hard and to use soft bristles as much as possible. So even if your immunity is low, it is always advisable to use soft bristles, because if you're using hard bristles and there is any kind of mucosal damage or any kind of tissue damage, bleeding happens, that can again become a source of infection. Razor blades should definitely be avoided, because if at all there is bleeding, then there will be a very reduced chance of actually getting the bleeding resolved. And definitely infection is also a factor. And this point is controversial, but it is interesting also. NSAIDs and aspirin should be avoided as much as possible. Now, I can only say that avoid as much as possible because, for example, if the patient is suffering from any cardiovascular comorbidity also, in which aspirin or clopidogrel has to be given. So in that condition, we have to look at the risk versus benefit ratio, and then we can do what is necessary. But still, if we are giving these medicines, it has to be kept in mind that the platelet level should be continuously monitored. We should obviously observe for signs and symptoms of infections, fever or whatever it is. And if fatigue is happening, then we can reduce that by engaging the patient in daily lifestyle activities or something. So with that, the patient can have a positive vibe. So these are the important things. So obviously this presentation has been actually a bit big, but this has given you a lot of practical insights, I hope, regarding a simple parameter known as WBC. So in future slides, whenever we are making future videos, we'll talk about other parameters. What are their functions in our body? In which condition it increases? In which condition it decreases? What are the symptoms when it increases? And what are the symptoms when it decreases? So all these things, if we come to know, then I obviously believe that pharmacy practice or the science of medicine will be definitely interesting for people. The major problem that we see and that I have seen in people or students is that they tend to forget side effects of medicines. And many of the side effects of medicines are actually electrolyte abnormalities or hematological abnormalities or problems with the LFT and RFT. So unless and until we understand what are the functions of these normal parameters in our body, we will never be able to say what are the consequences of the side effect of medications which alter these parameters. So in our future classes also, we'll be talking about that. Thanks a lot for viewing this. Please like, share, and subscribe. And share this message to maximum people as much as possible, because we are here to do something different. And with your support, we believe that we will reach the milestone of sharing maximum practical knowledge among people that are ready to support with us.